I'm thrilled to be here with our good friend, urologist, Dr. Jen Berman. Thanks for being here. We're gonna have some fun today. Okay, so let's just jump right into the first question. It comes from Samantha in Cleveland, Ohio. She writes, "Dear doctors, this might sound like a strange question, but I was wondering if a virus that causes sore throats like tonsillitis can be transmitted to my genitals from oral sex." Which I think, first of all, if your partner has tonsillitis, they shouldn't be down there anyway.
It isn't an unreasonable question, however, because viral infections can be transmitted from the oral area to the genital area, and specifically AIDS, HIV virus, the HPV virus even can inhabit the throat, as well as HSV, which is herpes simplex virus.
And they can go, they can go either way from, mouth to genitals, genitals to mouth. And bacterial infections as well.
Bacterial infections as well, but the common cold, no.
No. All right, so moving on, it looks like we have an anonymous caller on the phone who has a question about too much sex. Are you there?
I'm here.
Great. So tell me, what's your question?
Okay, so when does having too much sex consider you to be a sex addict?
As far as if you're a sex addict, that really applies to if it's interfering with your life, if it's interfering with your relationships, things like that, right?
I would say the frequency, the messages, I guess what you're saying, it's not the frequency of sex that you're having, but how it's affecting you.
Right.
For instance, is it interfering with your life, your self-esteem, your job? Has it become an obsession to where you're not able to sort of have healthy relationships?
Right. Are you putting yourself at risk? Are you doing risky behaviors where you're having multiple partners or not using any protection?
Yeah, it's
those type of things.
one partner, but 4, 5, 6 times a day.
Go for it.
If it works for you and your partner, then that's great. That's just healthy. Just keep at it.
And it's monogamous.
Yeah.
Thank you, guys.
Thank you. Before we go to break, let's take a look at this very common question for all the ladies out there.
I'm not pregnant, but it appears that I'm lactating. Is it actually lactation or some sort of nipple discharge?
Nipple discharge. This is something I actually see a lot. If a woman comes in and has a nipple discharge, we look at it. Is it from both nipples? What color is it? Is it bloody discharge? Bloody discharge is never normal, but you can have anything from bloody, clear, or yellowish or green discharge. And that can be a little bit more disturbing, as you would think. It all needs to be checked out. Bottom line, your doctor needs to evaluate it to see if it's just an infection, if it can be associated with other things like fibrocystic breast,
a tumor in the brain.
Tumor in the brain. Most of the time it's benign, especially if it's both breasts, but you've got to get it checked out.
Is it usually painless or non-painless?
Well, it can be either. If it's associated with pain, it may be more likely to be infection.
Like an obstruction of the duct or something?
Exactly, yes. You can have things in the ducts. So, again, needs to be checked out.